Hi, I'm Dr. Manjunath. Today we have Dr. Narmada. We are together here in Pedalarcon in Delhi, and I have the great opportunity to interview Dr. Narmada, who is a pediatrician and allergy specialist from Vellore.
Thank you so much. It has been my pleasure to join with you in your channel, which is very popular among the pediatricians.
Huh. Thank you so much, madam. The thing is, we have seen so many deaths which have happened in Madhya Pradesh and Rajasthan in the recent days, and a lot of them have been attributed to the cough syrups. But the biggest challenge and the roadblock what we have in treatment of pediatric cough is the usage of inhalational devices.
Yeah.
Is there a way we can educate parents better when to take a syrup, when to take an inhaler, when to take a nebulization?
Right. Actually, it is very important that the parents understand what the medicine we are giving. It is more of educating their parents about the kind of illness the child is suffering. I always believe in inclusiveness of the parents in the decision making, and we need to tell them the advantages and the need for each of them. So, suppose generally a child who's below 2 years, usually gets a very severe cough. It is because of a viral infection triggering a wheezing-like illness. So, in that, we prefer to give only the bronchodilator. But when we are giving in the syrup format, we might actually give it in the milligrams, and it is actually going through the system and into the respiratory tract. Whereas when you're going to give the inhalers, it acts directly on the respiratory tract where the action is actually required. Say, for example, you have a problem in the eye, you're going to give the eye drops for it. And it's the same thing with the ear. So only in respiratory tract we are thinking that syrup is safer, and we are trying to give that.
Only because it is sweet. Is that the case?
Maybe, and it's a perception. The moment you want to start them on the inhaler, parents think that it's such a very big disease.
Why not syrups? Give me some syrups.
Some syrups. That is the attitude. So I think it is onus on us to explain and what is the advantage of this, and where it is actually acting, and why do we need to give a cough? You need to give a bronchodilator. And in this case of a cough syrup, we all know the children do not expectorate or do not bring out so much of a sputum. Actually, that when if it is very disturbing, that is the cough is disturbing due to a postnasal drip or a nasal congestion, and the home remedies are not working, that is when we may prefer an antihistamine. So in this Madhya Pradesh, we have been using the cough syrup. The cough syrup as such has not been bad. The combination of chlorpheniramine, which is helping to bring down the congestion, and the phenylephrine, which brings down the cough, it gives some relief to the child. That's why they have been using. It's only the diluent which is the problem. So we have to be having a very good knowledge of what we are prescribing, involve the parents in the decision, and generally children less than 2 years, when they have a cough, it is more due to the bronchospasm, which does not require a cough syrup, and the cold can be easily managed with the home remedies.
So you mean to say a cocktail of medicines should never be recommended?
Exactly.
Make a proper diagnosis and give the medicine. A single medicine, that would be better.
Yeah, definitely. We don't need to fill our prescriptions with so much of combinations. We have parents who come and ask, give me one syrup for cold, give me one syrup for cough, and we have something for the parasite. It'll be like a
They also have a runny nose, runny eyes, watery eyes.
So that also they want. It is like it becomes like a poly medicine. Later whenever they go to a supermarket, they want one for that, one for this. Sometimes I ask them, don't stock so much medicines. They feel whenever they are moving out to some place, they want to take all the medicines together, and when they're moving from the mother's place to the mother-in-law's place also, every medicine they want to carry. So we need to explain to them. Generally they do very good with one paracetamol, your solutions, and if a child is particularly getting more amount of this wheezing episodes, then the inhaler is the best option for them.
I want to share one experience of a patient. He was about 3.5-year-old boy. He had multiple visits to the hospitals, and that father was saying that he had filled up a 25 kilo rack of gunny bag with the syrups. That was the amount of doctors and the medications which the child has been infused with.
Yeah. This, I think, is the onus of every pediatrician in order to make them understand what we are actually dealing. In order to label them as a childhood asthma, if we have to label them. Labeling a disease gives us much better understanding the disease by us, as well as explaining to the parents, and then they accept the treatment much better, because every child needs to have a breathe free world. They need to breathe free for themselves, and inhalers actually help them out with this. And one another thing that has caught up is use of nebulizers at home.
nebulization.
That is again another one bigger problem, because we all know whenever a virus induced wheeze comes, there is a component of hypoxemia. So when they are going to use home nebulizer, how did they get accustomed to home nebulization? It is just it's a shift in the social shift that had occurred during the COVID. So we have to tell them how dangerous it is, and inhalers are much more safer. Very much they can use it at the home, and they will have to make them accustomed to it.
Yeah, very true. So that way we have to encourage, we are going back to the same old statement: history, and history.
Yes.
Break down the disease, what the disease is, and then treat it accordingly. We are not against any physician, we are not against any pediatrician or any other general physicians. All of them are needed for the society. But just that we want to make that aware that every prescription, when it goes to a child, it doesn't come back. The child cannot take it out. If it goes to the system, it is there in the system, can cause trouble. Make sure of what you are writing.
Yeah, and be sure to write your diagnosis. Be sure if it's a childhood wheeze, you write it as a childhood asthma. If it's a respiratory infection, upper respiratory or lower respiratory, document it and give the prescription only for what it is intended.
Oh, this is one of the most fruitful discussions I've had, madam.
Thank you.
I'm really
Thank you for
grateful
the opportunity. I was also waiting to talk it out, because I really believe that sometimes we take some paternalistic decisions, but we need to involve parents, and we are guiding them towards the right direction.
Thank you. With this, I think we have been able to give the message what is needed, and I've done series of videos on the same topic. You can go back and check into my video, and this is a never-ending debate. This debate probably was done about 10 years back. We are having it in 2025, and probably this debate will happen even in 2035. So before that happens, we should educate every parent.
Yes.
Unless the pharmacists, unless the parents are aware of what they are doing, unscrupulous medicine use should be stopped. It's high time that India wakes up. It's high time the parents also understand that it has to be taken only under the prescription of a doctor and not otherwise.
Yeah, and acceptance of the disease is important, not only for the parents but also for the physician. And if it's a viral infection, it's going to last for 5 days. Yes, it is going to last for 5 days. So that's going to be there.
Thank you so much.
Thank you.